I think we'll get started here because we want to have enough time for our speakers, so we'll get things rolling here. I am going to be passing out a sign-up sheet on each side. If you've been here before, your name should be on here. It's alphabetical. If not, there's a guest spot in the back where you can sign up and put your email if you want to get the weekly updates and stuff. And then if you guys have any mileage or time that you spent on behalf of the DRB partnership, there's a column for that if you can put it, because it's nice to show our in-kind when we try and get grants or ask for money, we can show how much the community is doing. There's another highlighted section in the center here that's yellow. That this year, and we'll talk a little bit about it, our DFC grant, Drug-Free Communities grant, actually ran out at the end of September. And that was where we got a lot of money and grant money to do a lot of events and stuff. So with that being gone, like our January celebration, music costs us about $1,000 or so to put on. So we're looking at different options. So it's just a question, would you be willing to pay if you've ever been to the January celebration? Would you be willing to pay a few dollars, and how much would that be? If not, please put no on there. Because it's just a feeling right now. We're looking at getting sponsorship for different events and stuff and trying to find different avenues of money. So if you can do that, that would be great. The minutes would be back on the back of your agenda. So if anybody has any concerns about that, anything that they see that doesn't look right, if you could just send Melissa an email and she can send out a correction if there's something that's that doesn't seem right for you. Another thing we want to mention is all our recordings are online from this and all our other presentations on our YouTube. So if you really like something you saw at one of our meetings, you can go back and watch it, or you can let other people know so that they can look at it as well. As far as financials, we have online right now $3,538.88. That does not include our community foundation.
That's community foundation.
This is community foundation, so this is not what we have in checking in other areas, but what we've gotten in donations. We're also looking at board recruitment now for people who are interested. We have several people that are going to be done this year on the board, aging out, as Melissa likes to say, and so we are looking at a co-chair, which is a 3-year commitment. You'd be a co-chair or vice chair 1 year, chair the next year, and then past chair the 3rd year. So if you know anybody that'd be interested, that's passionate, that might be a leader, that would be good at it, keep that in mind. We're also looking for treasurer and secretary, and then members at large. So if you can think of anybody or you're interested, please email Melissa with those names and what positions they might be interested in. The other thing that we wanted to mention too is that, again, going with the DFC grant being done, that's going to maybe change the face of AOD partnership and how we do things. We've been working a lot the last few months, having meetings, looking at funding. It looks like the county is probably going to pick up our staff position for this next year. But even if they do, it may change some of the functions that she can do. So we're still in the process of it. In case you'd heard rumors and wondering what's going on with that, we will keep you updated as things move along and how things are going to work as far as that goes. We do have a few stats that are going, pushback and impaired driving. We haven't had many meetings on those recently with the impaired driving, but if you're interested in those, please sign up on the sheet and we'll get you information. And we're also looking at the January celebration, getting a short-term action team together to maybe look at funding and how we can, make that better and keep that going, because it seems like every year it gets better and better. There's been a few save the dates up here that have been running to keep in mind a candidate forum, on health. That'll be at NTC. That's a chance to ask the candidates who are running, what their thoughts are on issues that would concern us. Ashley's story is a free training or presentation at Rasmussen, where an Green Bay officer's daughter was killed by a drunk driver, and that's a 3-hour session. It's free. You can register online. And the Guiding Good Choices is a thing at the Family Resource Center, and then the Rays of Hope will be our 5th annual celebration on January 29th. And then we are going to have a short presentation on Serenity Retreats by Rebecca Kermitz.
Becky here.
Rebecca
You
here?
made it.
Well, we're not going to have that.
Well, I think there's actually a couple people here for the things that are coming up. So I'm going to stop this from going so fast.
I was doing that.
Oh, guess who? I forgot to pick these up. In addition to the ones that Bob mentioned, this is actually there's a training that North Central is putting on for prescription. Well, it's related to prescription drug abuse, but it really is looking at how to identify and intervene with mental health and substance abuse needs in primary and emergency care settings. But it's a free training and they're offering CMEs. So in your places, you should have a whole sheet with all the slides from our updates. So hopefully you find information there. All this information is always on our AOD partnership calendar, so you can draw down from there. If you didn't see the videos from the Faces of Recovery Luncheon, go check them out. They're on our YouTube channel. They're awesome. The Serenity Retreat, I was hoping that somebody's going to be here to talk about these, but you do have a slide that talks a little bit more about those. And I haven't posted these to our website yet, but you have, I can get you that information if you so need it, but it will get posted sometime this week. A point of, to point out, for our pushback initiative, also in your place, you should all have a little thing that says pushback or September Summit survey. For those of you that weren't at our September Heroin Summit 2 weeks ago now, we were asking people kind of where they want to see us take our pushback initiative as we go forward. So if you have some time, during today, that's in your packets. I'd love to get some feedback back from you. We are planning to have a meeting on Monday, October 20th at 3 o'clock. I haven't set the location yet, but that'll go out through our weekly update. So if you don't get those, make sure you do the sign-in today, like Bob said. That will we'll sign you automatically up through that. And also, the summit video is available in its entirety, so you can view it, share it online. If you weren't able to attend, it was phenomenal. The Guiding Good Choices, more information on this is going to come out as it becomes available. We're going to be asking our community partners to help refer parents, and even if you're a professional working with children 9 to 14, right, 4th through 8th grade, if you're working with somebody that age, if you're interested in it, it's a free program. It's three different sessions. They're 2 hours apiece. We're going to be looking for sponsorships for meals and things like that for that too. So as information comes out, we will share that with you through the updates. The candidate forum, like Bob said, it should be another good event. I'll have Aaron update on Western Marathon counties quick.
Sure.
Do you have any update?
Yeah, the next update is just our next meeting is next week, Wednesday. We're all the way in Spencer, but we're doing some good work out there. We're collecting some data right now. We're getting the schools on board with the youth risk behavior survey. So the Western Marathon Counties Coalition is really just gathering data and working, and hopefully by the end of this year we'll have some stuff that we can prioritize. So
perfect. They do have a website, so go check it out. And if you live or people that live or work out in Western Marathon County, encourage them to get involved in that group, because it is really quite neat to have 7 different communities working together on an issue so important as this. So it's exciting. And I think before we move into our other partner updates, Gina is here somewhere, I know, because I talked to her. There she is. Gina, could you tell us a little bit more about Ashley's story?
Yeah, what was said was actually really great thus far. Basically, that flyer that I had given to everybody on Ashley's story is some detail of the event. Basically, Mike, and I don't know how to pronounce his last name, I think it's Metzger, a 22-year law enforcement vet. Kid lost his daughter to a drunk driver while he was working, and he was unable to save her. I think it's going to be a very touching story. So that event is actually going to be held at the Wausau Rasmussen College campus on October 29th. That's a Wednesday from 9 until noon. It's a free training concerning violent crime, victimization of law enforcement officers and their family. So really informational and likely very touching as well. If you want to sign up, you said that it was going to be on
The registration link is on the AOD Partnership website, so if you go into the calendar, you can click on the information on the event and register through that link. And Ron has an update. I know. You don't have to talk right into it.
Oh, okay.
Formality.
Thank you very much. Yeah, I want to make an appeal to save the public bus transportation in Weston. How many here live in Weston? We need you guys especially. Again, the public bus is threatened, and it's going to be a binding referendum on the November ballot. And obviously only the people in Weston can vote. But Naomi, which I'm part of, we were active 3 years ago in the campaign. We're able to save the bus. The problem is, if the bus goes down in Weston, it'll threaten Schofield, Rothschild, and even put pressure on Wausau to maintain the bus service. We lose the public transportation, we lose the paratransit. So anybody that needs a handicap accessible transportation will not have any. The cost per Weston resident, I don't have my fact sheet with me, but it's actually minimal. It's not that costly an affair. So I need you to turn out. We'll be going door to door October 18th. We'll have fact sheets. We're going to try to counter the rumor that the bus is always empty by having accurate rider information, and hopefully we all come from a place in life where we can see that public transportation for those that don't have a car is essential. Employment, healthcare, recreation, you name it. So please keep that in mind. If you have friends in Weston, make them aware of it. Look for information that'll be in the paper. There'll be public forums coming up. And again, we'll have our campaign on the 18th. And if anybody is so inclined to come with us and knock on doors and hand out information, Goodwill, Weston, October 18th, 10 o'clock is where we'll start. And we'll have 2 shifts, 3-hour shifts. You can work the whole afternoon and day if you want it, 10 to 4, but we're breaking it up into 3-hour increments. So this is a crucial, essential action for our greater Wausau community focused on Weston. Thank you very much.
There is more information up on the screen right now for Serenity retreats. You'll see that the first weekend is already passed, but that doesn't mean. And I was told at any time you can go and attend these, or you can let people know they can go and attend these. So this information, like I said, I will post it onto our website, just like the Guiding Good Choices. They'll be posted onto the website as well. Is there any other partner updates before we get started?
I'm Ethel Twisler, and I'm a community advocate, although I'm also part of Naomi on the TIP task force and whatnot. I'm also part of the Ministry of St. Vincent de Paul, and we are offering through the AHA process, which is a professional development program company, the Getting Ahead and the Getting By World program. This is in development, so there's more flyers on the table here. I'm just letting people know that if you want to be involved and help with this, this is for people who apply for this program, make a commitment to investigate their own lives and their community around them. This is Hope in Action, Ending Poverty, One Person, One Neighborhood, and One Community at a Time. It's about systemic change. And I'm looking for people to help with endorsement. I have a couple more spots available on the steering committee, looking for advocates and allies, and just getting the word out, and there's more information to come. I'm done.
Sorry.
I tried to
Shutting
make
the door.
it brief.
There's another training going on, and I'm sure it'll get pretty ruckus in here. Any other updates? Anything else? Okay. Perfect. Well, let me just hook this back up here. Are you a wanderer? Well, then I'm going to have you put that right in your pocket. So if you want to come up and put it in your pocket. We're very fortunate to have, I'm going to probably, intelligence agent John Kumm out of the Milwaukee FBI office to come and talk to us a little bit about a report that was released last year called, you see it on your screen. You all have a mini copy in front of you. I was trying to save paper. and my staples are not straight and all that good stuff. But if you want to download a copy, it is on our website. And I think, unless you need anything else from me, I'm gonna try to get out of the way. Here, have you put that in your, on you? On you. And you all should have copies, and if you're sitting on the outer layers, if you didn't get copies of some of this stuff, they're back on this table here, and there's a lot of resources out there. And this is the last, I'm gonna plug again. Make sure you sign in. Because when I look at the sign-in, we have 35 people on our list, and I look around the room and I know we have more than 35 people here. It's helpful. It makes you fill out your evaluation even if you have to leave early. Thank you.
Well, as Melissa stated, my name is John Kumm. I'm an intelligence analyst with the Milwaukee FBI. And all of you should have a copy of the Wisconsin Heroin Assessment. Basically, what I'm going to talk to you today a little bit about the assessment. I decided to kind of do it a little differently and use the handouts instead of doing a PowerPoint presentation, because usually when I do the presentation it's about 2 hours, so I don't want to keep everybody here for 2 hours. So basically what I'll do is I'll kind of go over all of the topics that we covered in the assessment, and then definitely take any questions that you might have, because heroin is something that is not only law enforcement related, but it's community related, it's health department related. It's something that we all have a hand in trying to stop and trying to prevent. But basically a little background about the heroin assessment. It's in there in the sheet, but basically starting in about 2012, myself along with a number of representatives from the other agencies that are symboled on the front sat down and said that we have a problem in Wisconsin. We have a heroin issue and we need to do something about it. We need to see where it is. We need to see where it's going. Nobody else had done it. And we decided, who better than us to at least try and take a stab at something. Now, granted, this is not the most comprehensive assessment that's ever going to be out there. I mean, it doesn't have a lot of health stats and stuff like that. But primarily we are law enforcement agencies, so that's the angle we took. And if you tend to start, heroin's such a big issue that if you tend to try and take in everything, either the document's going to be so large nobody's going to want to read it, or you're never going to finish it. So we had to draw some barriers and some lines about where we would actually cut it off. But basically, as she said, she doesn't have it up there, but the bottom line is, and I'll just read it from here, that heroin in Wisconsin has steadily increased since 2008. And the trend is expected to continue. The use of heroin is likely driven by an increased use in addictive opiate-based pills. That's definitely something similar we've seen to other states across the country. And then the pills in conjunction with heroin is serving as a lower price alternative. The abuse of heroin is further exacerbated by the lowered overdose risk due to increased availability and use of Narcan. And then the increased use of opiate-based prescription pills in Wisconsin is expected to mirror the national trend, and further increased use of heroin due to these pills serving as a gateway to heroin abuse. And then, as I kind of stated before, law enforcement efforts alone are unlikely to mitigate heroin use in the state of Wisconsin due to the myriad of factors contributing to its spread. So, if we start going through and we look at it, we basically took a couple sections in the paper and broke them down. So what's the data on heroin? How do we know that it's increasing? Where is the heroin coming from? Who's using the heroin? And then what are the surrounding factors of it? And in the first one, we state here that we assess with high confidence that heroin is increasingly available in the state of Wisconsin. We know that because we have data from health officials, we have it from law enforcement officials. Law enforcement officials are working more heroin cases now than they ever have in the past 25 years. They're seizing more heroin than they have ever in the last number of years. It is definitely something that we've continued to see, so we are very confident that heroin is increasing in the state of Wisconsin. Next, where is the heroin coming from? A lot of times, everybody thinks that heroin comes from Afghanistan. Well, it's true, it does. A lot of heroin comes from Afghanistan, but it doesn't come to the United States. Heroin in the United States comes from Mexico and it comes from South America. So primarily that's where Wisconsin heroin is coming from. It's not coming from foreign countries far overseas. It's coming from our next door neighbors, our countries right next door. And then from there, it's traveling up to Chicago, which is one of the largest drug hubs in the nation. And then it flows up to Milwaukee, up the east coast of Wisconsin. For Wausau, it might flow through Madison, up the interstate. And the western part of the state can come from Minneapolis too. So basically, we have all of the surrounding metropolitan areas are areas that individuals go to pick up heroin, bring it back, and distribute it in our state. And then nextly, it's like, who's trafficking heroin? Well, heroin is trafficked by every ethnicity, every race, every age. But there are a few trends that you tend to see. Primarily it's gang members who traffic the larger quantities of heroin into the state. And then throughout the state, you actually see more just individuals trafficking themselves. So for example, from Wausau, you may have a gang that trafficked heroin from Chicago to Milwaukee, but you have an individual right here in Wausau who travels every day, every other day, once a week to Milwaukee to buy heroin and bring it back to your community. And that happens all across the state. So just because you don't have a gang here doesn't mean you don't have a drug problem. You have individuals who travel to where the drugs are, pick them up, and bring them back. And then nextly, heroin is more difficult to detect than other drugs due to the quantities that are used. We're not talking, when we talk about heroin trafficking, we're not talking about pounds. You're not seeing 3,000 pounds of heroin being brought across. You're talking maybe 1 or 2 grams at a time. Things that are very, very small, but yet they're still very, very potent. A heroin user, each time they inject, uses about 1/10 of a gram of heroin. So just extremely small. So for law enforcement, for our concern, is that when you're trying to look for stuff like this in the cars, it's very difficult to detect, because think about all the places you could hide possibly 1 gram of something in your car versus having to hide, say, 10 pounds of marijuana. That's a little bit harder to hide in your car than something extremely small. So from our perspective, that's something that's very hard for us to detect, and something that we definitely have to get better on, and we're working to get better on. Then the next thing that we've seen is one of the trends kind of associated with heroin is the rise in property crime. Pretty much every law enforcement agency we talked to said that when they have a heroin problem, they see an increase in property crime. Why is it? It's because heroin, even though it can be cheap to purchase, over the long term of an addiction, it becomes very expensive. And individuals need to get money to facilitate their addiction. And so majority of the time, they turn to crime. And so these aren't the kind of crimes where, large scale crimes, but these are petty crimes. These are retail thefts. They're stealing TVs, they're stealing items from somebody's home. I mean, they're small crimes, but they add up. And across our communities, we've seen an increase in this type of property crime, definitely associated with heroin use. One of the examples that we like to give is there was a community in southern Wisconsin who said that they had a street where I think there were like 10 houses on the street, and 9 of them were burglarized except for 1. So they go to the one house and they find that that's the house of the heroin user, and they confess to burglarizing all their neighbors' homes. So it's definitely, and it was a small town, a small rural town, so something like that really sticks out in small communities. Not so much in the larger communities where there's a large amount of crime, but in smaller communities, you can see a definite correlation between a heroin user and property crime. And then next, as I just stated before, it's well known that there's a correlation between heroin use and prescription pills. Why prescription pills? Specifically prescription opiates, because they're chemically similar. They're all, basically you have pills like Vicodin, Oxycontin, along those. They're chemically similar to heroin. So when the body gets addicted to one of those pills, it can also be addicted to heroin. Now, that doesn't mean every prescription pill user is going to become a heroin user. I mean, there's plenty of times, I mean, I've had prescription pills, I've taken them, I mean, there's no issue, but I mean, it's sort of the same thing along the lines of alcohol. Everybody who drinks alcohol does not become an alcoholic, yet there are still certain individuals who do. And so prescription pills are very addictive if abused, and it's those individuals that we specifically are worried about at becoming heroin users. And then next, Narcan. Narcan is a drug. I don't know if all of you know what Narcan is, but Narcan is basically a drug that helps in the reversal of an opiate overdose. It's only used for opiate overdoses. It's the only thing that it will ever encounter and ever work with. You can't overdose on Narcan. It's in the absence of opiates, it doesn't have an effect on the body. But Narcan is used to help individuals who suffer an opiate overdose to basically revive them and bring them back. Narcan is great because it gives individuals another chance at life, another chance at being clean. But on the other side, it also prolongs heroin users' lives in making sure that they may they may have the opportunity to further spread heroin in the meantime between their opportunity where they want to get clean. One of the things I like to point out is it was back in about the beginning of the year. I believe the New York Times did an article on a mother out in Hudson, Wisconsin. She recently lost her daughter to a heroin overdose, and they were talking to her about what she was doing in her community. And one of the people they actually talked to was an individual who was sitting currently in jail for heroin distribution. And he said that he was probably responsible for bringing heroin to the Hudson area. And through talking with him, and you can actually see this in the article, and it's usually missed, the individual said he had overdosed 5 times before he decided to get clean. Thank God that he decided to get clean. But in the meantime, between the first overdose and the 5th overdose, how many lives did he affect? How many people did he get addicted to heroin? It's great that he did. Narcan should be given to everybody in the event of an overdose. It should never be withheld. Everybody should have a chance to have a second chance at life and to have have an opportunity to get clean and to stay clean. But from a law enforcement perspective, what we're looking at is that time, between what does an individual do between that first overdose and the second overdose. And there's a lot of times, when individuals who are addicted to heroin, it's so powerful, they don't want Narcan administered to them. There are emergency medical personnel that'll tell you when they revive somebody from a heroin overdose, they wake up and they're mad. They're mad because you just ruined their high. And so that's the last thing that they want to do. And the first thing they do when they get out of hospitals, they go look for more heroin. And so they continue to foster the heroin trade. Now, granted that Narcan saved their lives, it'll continue to save their lives, but Narcan doesn't stop the heroin addiction. It's not something that when you have it, it'll help you get over the addiction. It's just kind of, it's something in the middle that just helps you from overdosing, but it won't stop the addiction, it won't stop the cravings. And so then lastly, the other thing that we took a look at were the needle exchanges. Wisconsin has a number of needle exchanges across the state. Basically what they do is they provide free, clean needles to heroin users to stop the spread of HIV and AIDS from intravenous drug use. Now, there's never been a correlation between the rise of the use of heroin and the provision of free needles. However, one of the things that we found that it does do is it helps take away kind of the stigma of heroin being a dirty drug. One of the things, those of you who are old enough to remember, back in the late 70s, kind of early 80s when heroin was back around, it had this kind of reputation of, it's dirty. I mean, you don't want to stick a needle in your arm, you don't want to do this, and because you could get AIDS, you could get hepatitis C, you could get a bunch of other diseases. And while the needle exchanges through their provision of free needles they've helped reduce the transmission rate of HIV and AIDS through intravenous drug use, but also, they've lowered kind of what we said are the logistical barriers of heroin use. So now you don't have to try and figure out where to get clean needles, where to get little cookers, where to get ties, all that stuff. You can get that all from your local needle exchange. And so that's, for law enforcement's perspective, that is worrisome for us. But then the outlook, basically, Wisconsin mirrors the national trend for prescription pills. Prescription pill abuse is increasing across the country, not just in Wisconsin. Wisconsin's not alone, but we're also not one of the top abusing states. There are other states out there that have higher prescription pill abuse rates than we do. But together, they're all increasing. So when we look, Wisconsin isn't going to buck the trend in prescription pill abuse. So as we look going forward, we expect it to only get worse and to have a larger impact on the state. But one of the things we can do is by working together, kind of the reason we're here, is to try and figure out how we can help kind of lessen the impacts in our community. And I think, as I said before, if I didn't, I apologize, the best way to stop kind of the heroin wave is to get individuals to never start heroin. I mean, when they start heroin, it's something that they're going to deal with their entire life. They're going to struggle with it for their entire life. It's an addiction that's going to grab a hold of them. It's not only going to affect them, it's going to affect their families, it's going to affect their friends, and just not even starting heroin is the best way to curb it, and to let kids and young people know that, hey, you know what, it is dangerous. It doesn't matter how many free needles you might get, or like how safe you might think it is, or somebody might tell you it's safe. It's not. It is definitely not safe. It's one of the most dangerous drugs out there, and it's not even something that you should dabble with or even attempt to use, because once it gets you, as you've probably seen by some of the advertising by the Wisconsin Department of Justice, once it has you, it doesn't let go, and that is something we definitely don't want, in our community, and we don't want our kids dealing with, and we want them to have a better life than trying to struggle with heroin addiction. So kind of at that, it's kind of wrapped up, kind of the quick and dirty details of what we found, but I'm definitely willing to entertain any questions from the group if anybody has any. Yes?
So, John, your last point was excellent. Probably the most important thing you said in your whole talk. But, from the law enforcement perspective, you guys have wrapped up the majority of the money for the war on drugs, which by most scholars and most people has been a failure. So in order for us to have the money we need for prevention, you guys got to give up some of the bucks so that we can put it to where we can have the most impact. Are you willing to do that? Are you willing to foster that shift of funding from this war on drugs that's been a failure to a war on to a prevention perspective?
Well, commenting on the war on drugs is definitely beyond my pay scale and my ability to comment on, and especially with funding. I definitely believe that funding should be available for treatment and all of that. Obviously, I'm not in a position to basically foster that. Being in a law enforcement agency, I'm not able to make we're not able to really affect policy. I mean, something like that should be something that you bring to your local congressman, you bring to your local representatives, and tell them, hey, you know what, this is it. This is what we need. We need treatment, and that's part of the reason we wrote the heroin assessment, was to help individuals and political people and leaders in our community realize, hey, what is the depth of the problem? What is the scale? What do we need to do? And that's also part of why you're here today, to kind of help impact people and get them talking about what do we need to do.
I agree. I do it all the time. I need you to help us. I need law enforcement to kind of also be a voice in that change process. I think that, because it is a big thing, and we all have to do it together.
Yep.
And I agree.
Yeah.
You're telling us that because of rules, guidelines, regulations, you can't. But if you could, what would be the first step to that?
Can I have you repeat the questions to make sure that it's getting
Sure.
picked up on the mics, please?
Basically, the question was, how do we facilitate funding for treatment programs? How do we?
If you could.
I really can't. Like kind of like I said to him, it's community outreach. It's talking to your friends. It's talking to your neighbors. It's definitely talking to your local elected representatives. It doesn't even have to be your congressman. I mean, it can be as much as your county supervisors, your local assemblymen.
Well, what if there was just a decision made in the department that said, how we put X number % down for, just a seed to start funding for that?
I really can't comment on how we as the FBI would do that. That's definitely, like I said,
Is
beyond.
that something you take back to your office?
I definitely can. I know it's something that we've looked at statewide through this. I mean, it's definitely something that needs to come out because yeah, there do need to be more treatment
Well, let me share with
programs.
you why this is confusing to me, okay? Because FBI, law enforcement, and whatnot, they are getting monies from tax bases, correct? All right? So if we have these different departments that are assigned tasks to do for the American people, and they're being funded for it, there must be a way to intelligently have that money available to the greater good. Here's the thing that really confuses me. For example, I went to a training for Red Cross disaster training not too long ago, and the Red Cross Wisconsin league gentleman, Ken Warner, had shared that Congress gave this task, obliged the Red Cross years ago to be there when there's a disaster, to be there when there's a problem as small as your local house fire to as large as Hurricane Katrina, 9/11, those types of things. However, Congress does not fund it. It comes directly from donations of the American people. That is public information, however, that does not trend in the media. Okay? So, again, help me understand how I can become unconfused as to how those dollars could benefit.
Can we keep, I'm sorry, I'm just gonna, I think we need to keep the questions to the report right now for Agent Kumm, just because that is his wheelhouse. That's what he's here to talk about. I think, on a local level and stuff, I think we can definitely have a dialogue
Okay.
on that after we're done with questions related specifically to this report. Is that fair? Okay, just to keep, we don't go too much off. So keep that thought. Karen?
We'll probably look at the report too.
I recognize most of these agencies listed on the front of the report, but the HIDTA is new to me. What's the hierarchy there? Where do they fall in under things like Justice Department and FBI and stuff like that?
The Wisconsin HIDTA falls under the Office of National Drug Control Policy under the White House. They received their funding there. I believe it began somewhere in the 80s. It's basically what we call a fusion center of law enforcement agencies. So you have local law enforcement agencies that all kind of give one or two men to kind of the greater good of trying to work on specifically drug trafficking.
So it's like a coalition,
Right.
law enforcement coalition?
Yes.
Okay.
Yep, and there's a number of them scattered. I believe there's, I want to say 24, but I'm not quite sure,
In the
across the
US?
country. Yes, in the US.
I think we have 3.
We have one in Wisconsin, that's it.
We have 1?
Yep.
I would say.
Yes.
So first of all, Agent Kumm, I want to just thank you for the information that you provided for us today. This is really great information. And my question is, so I'm Dawn Perez from Social Services here in Marathon County. Has there been any research as far as evidence-based programs that have shown any effectiveness around the state in addressing the heroin epidemic? And in any one of the pillars of prevention, of treatment, of enforcement, or on the national trends? Have there been any evidence-based programs that are showing any success?
I'm going to let you know right now, we've primarily focused on law enforcement side of it because that's what we do. I mean, that's the agencies we are. we decided not to go into health department officials just because that's not our specialty. That's not what we know. I do know, however, from meeting with a lot of community members and doing other meetings like this around the state, Milwaukee does have a lot of good programs that they use. Specifically off the top of my head, I don't remember what they are, but they recently had a very large heroin summit for kind of the 8 counties surrounding Milwaukee County in, I want to say it was in June, where they talked about this, and you can actually find their stuff online. I can actually send Melissa the link for that, and she can send it out to everybody, where they kind of talk about the heroin issue and more from a health perspective than anything I would be able to give or able to talk to. And that would be a good resource for you to maybe contact those programs and see what they're doing, what worked and what didn't. I'm sorry, I just don't have more of the health information.
Just a quick question. If you don't, I understand. Do you have any information in regards to how central Wisconsin or Marathon County compares to other regions of the state with the heroin problem? Any stats and all, or are you more focused on just the whole state?
Well, I mean, the only thing we really have are the statistics that we receive from local law enforcement.
Okay.
It's definitely a problem here. Is it the worst problem in the state? It's not. But the problem is that, from when the heroin started coming back in about 2008, Marathon County didn't have an overdose death until about, I want to say 2010, is when they experienced their first overdose death. And that's really the most important sign, is when people start overdosing, actually dying in your county, that you have more of a problem, that the problem's getting larger. There's just the amount of users are increasing, so eventually somebody's going to overdose. But that's really the data we have. Obviously Milwaukee County has the largest problem just because it's the most urban, has the most individuals. But any city in the state of Wisconsin has a heroin issue. There's really not a city in the state that doesn't have some sort of heroin issue. And it's only getting worse. Yeah.
From a very simplistic perspective and hopeful perspective, your agency and many of the government agencies work every day in and day out to keep terrorists out of our country and keep us safe.
Mm-hmm.
How is it that we find it so difficult, or we can't seem to address, drug dealers and drug trafficking that is coming into our country and terrorizing us from within?
Mm-hmm.
Is it the type of report that you've written, will that raise awareness, higher the elevation of the need for the agencies to address things of this nature? I don't know. I guess I struggle with that. Why do we have a failure on our drug, war on drugs?
Mm-hmm. And again, commenting to the war on drugs, I wouldn't be able to give overall comments. But from a law enforcement perspective, I mean, you see individuals every day who may or may not be heroin users, may or may not be heroin abusers. I mean, they don't exhibit any symptoms. I mean, you don't know until somebody overdoses. I mean, it's the time a lot in college where you have the girl, who overdosed. I think there was recently a girl at UW Stout who overdosed, and nobody had an idea about it. She was a good student and all this stuff, but nobody knew that she was struggling with a heroin addiction. So a lot of the times it flies under the radar. And then also, a lot of times in smaller communities, we don't have as much resources. I mean, there's not as many police officers. I mean, you don't have a large police office like Milwaukee does. Wausau maybe might have, a tenth of the officers. I mean, for them to be able to get to not only try to focus on drug trafficking and stopping that, but amongst all the other things that our law enforcement are tasked with doing, it's very difficult to be able to focus on one thing, and they always do that the best they can, and they'll always address it when it comes up, but to be able to proactively take out everybody all the time is very difficult for them.
Can you break down what HIDA is, and if there's any discussion on expanding its service, like what the benefits are of being part of HIDA, and if they're looking at expanding it in the state?
Sure. HIDA stands for the High Intensity Drug Trafficking Area. Basically, as I said, it's kind of a fusion center of law enforcement agencies. Currently, HIDA covers, I want to say, about 10 counties in Wisconsin. It covers southeast Wisconsin, Dane, Rock County, and Brown County. Basically, the counties petitioned to join HIDA, and with that, they have to also kind of give up some of their resources to contribute to the HIDA program. The benefits for law enforcement for joining HIDA is it kind of gives them avenues to other parts of the state for information they may not be able to get. You have something going on in Marathon County. I mean, for drug related, I mean, at some point it's going to tie back to Chicago. And that's not always apparent when you're right here, in Wausau doing this. But through HIDA and their investigative resources, they might be able to help, the law enforcement with that to actually track it down and to kind of stop the drug trafficking on its way up here. So, it's the best I can give.
Any other questions?
Yes.
Is Narcan readily available in the street, or is it just through health professionals?
It is available on the street. It is a controlled substance. You do need a prescription to get it, but the needle exchanges do give it out for free for individuals who do require it. And I know there's some talk about making it over the counter available, but so far as of yet, that has not. The FDA has not approved that. But then recently with some of the state bills that were passed, a lot more of EMS, law enforcement, and fire officials are now being required to carry Narcan as well.
Because Narcan is what's used for anesthesia, to reverse anesthesia. So that's why when you say opiate, it's going to reverse.
Right, yeah, if it was an opiate anesthesia, such as like a Vicodin or a Oxycontin or something, one of the opiate-based pills, I mean, that's all Narcan does, is it helps reverse that. There's another question. Yes.
So with the assessment, what's your next steps or plans now that you've put the data out there?
Well, it was kind of a lot of things to do was to do the interviews such as groups such as this. We did presentations for law enforcement around the state. There's obviously we sat down with the press, and there's been a number of press releases done regarding the assessment. Kind of what we're kind of hoping that we would see is that we let this know that this is a problem, and then the community take up the mantle and saying, hey, we have issue, here's at least something that we have that documents. I mean, there's nothing else like this in the country. This report, no other state has done something like this. So by raising the awareness, it's hopefully helping create that discussion. Talk to your legislator, what laws can we do, where can the funding come from to help treatment facilities, because really it's the legislators that are the keys to that and helping get those programs up and running.
So do you plan to, are you familiar with the scale of the State Council on Alcohol and Other Drugs report?
Yes.
And how that might mirror the law enforcement pillar of that report?
I haven't read it yet. I have been in contact with them. I know they're aware of our report, and I know they have it. So I haven't exactly seen what
The
they've
report
written
that
down.
Danielle's mentioning, there was copies out there, but they're all out. You can actually download them from our AOD partnership website, so you can get the digital copy of the State Council on Alcohol and Other Drug Report. There's 3 of them that are still out there, though. There's one on screening, grief intervention, one on 911 Good Samaritan recommendations, and one on prescription drug abuse. So grab one on your way. But the heroin one is available online.
Do you know if our governor was aware of that report and has he commented on it?
I don't know.
Scioto report?
No, the assessment.
I do not know.
Any other questions specific to the report?
Yes.
Kim?
Is this is the heroin assessment, do you do one for other drugs?
We haven't done.
That you would share with the public? I mean, I'm sure you guys are doing assessments all over the place, but ones that are available on other concerns?
We haven't done one to the scale on others, but as you said, yeah, we definitely have done assessment on other drugs. But those are primarily kept with law enforcement. But as for something for this scale, definitely because it's affecting the state as wide as it is and as hard as it is, and it's pretty much the #1 cause. I mean, if you go around the state and ask law enforcement, what are their concerns, I mean, it's always going to come up with heroin. So we found a need to actually go, extra steps and do something extra to make sure that this report was not only complete, but it got out to the public because it is has such a community impact.
And just to be clear, you said it was law enforcement agencies that contributed to this report.
Yes.
So it's what you guys see on a day-to-day basis.
Yes.
That helps you.
Yes.
This is, I guess, giving the question to both of you. What have you seen the trend, this is February 2014, from February last year. How much of an increase has there been, do you know?
I particularly don't know. The hard thing when you're dealing with a lot of stats and statistics and taking cases and stuff, there's usually about a year lag time and to be able to see what happened last year. So even for the report, even though it came out in 2014, the data we used ended in 2012. Only because we're collecting all through 2013, and if you just continue to collect, you have to have some type of cutoff date.
And how much of an increase have you seen? 100%?
I don't know what the exact increase would be from 2013 to this year. I know that along the lines of what we're talking about from about 20, well, I think I can't really remember, but I think the number of overdoses statewide in about 2008 was somewhere around, I want to say 18 to 20. And then in 2012 when we did this, it was about 230. So we have a large number of overdose deaths that have increased, and 2013 I know was more than 2012. How many more, I don't really remember, but the numbers are just continuing to go up.
If we've got a lot of experts in the room, so I'm looking at Jess, who's our medical examiner. She'll be able to explain some of this. We've got Dawn, who works with social services. We've got law enforcement partners here. We've got Deb, who has a long history of doing treatment here in the community for opiates. So I guess, Marie, I don't know if you have anything to pitch in from probation parole, but do you guys have anything locally that you want to tell them?
2011 was when we first started seeing heroin overdoses. We had 3 that year. 2012 we had 4. 2013 we had 3 heroin overdoses, and this year so far we only had 1. So I don't know if the Narcan is really helping in the community. I know that EMS reports using Narcan a lot more often, and I know a lot of our overdoses that we have had Narcan in their system, meaning that someone was physically with that person when they overdosed at that time, gave them Narcan, tried to resuscitate them, and then it was not successful, and then just left, knowing that that person probably will die.
Are we able to track how many times Narcan is administered throughout Marathon County in a year? There's EMS data out there, but the way that it works, Destiny worked in the needle exchange, so she'll be able to correct me when I'm wrong. But what happens is you get trained at the needle exchange, and the individual gets trained, you get sent out with 5 doses. When you come back and you request more, they ask how it was used, but they don't require how it was used. So we can have an idea of how much they give out, but we don't have a good picture on how much is given. Plus, you can't use just EMS data because there's people that show up just at the emergency rooms after, or they recover and continue on. Like, it's a very fuzzy number. So we just don't have a good accurate picture.
And Melissa, you had talked about the heroin summit that we just had. It really, if you go on and watch the YouTube video, you can see the last year's trend. You can see over the last 3 to 4 years trend. There's data specific to Marathon County provided by Deb Hagar, as well as a number of other community members. So if you want to know how it's impacting our area specifically, what the estimated cost is, and what some of the byproducts of heroin are in tearing families apart and killing people and ruining lives, you can see that all on that YouTube video.
Deb, do you have anything to contribute?
I think you guys did a great job. In fact, I didn't realize you were sitting there, I didn't pay attention. And I was just gonna quote what you were talking about she came to, about, 2 weeks ago? Or no, last week, and spoke to our adolescent program, the Choices Group, and was providing some of that information, so.
Yeah, $5 million in county services in last year alone, in 2013, to address substance abuse. It's not all heroin. We can't fool ourselves. Alcohol is the #1 drug that's costing our community over $1,100 every man, woman, and child. But heroin is definitely something that is contributing to the mortality of our young adults. Any other questions specific to the report, or any other?
Okay.
Oh, on the resource table. Thank you. You want to have a seat? Someone else comes up, then we can get back to you. There's resources out there from the Fly Effect campaign that
Agent Kumm alluded to, the Department of Justice did a community awareness campaign for raising awareness on the issue of heroin. So there is some fact sheets out there, there's some posters, you've got places you can hang up the posters, there's more posters for download, so help yourself to those. As far as what we're planning locally, I encourage anybody that has a passion for this issue to get involved in our heroin stat, because we're ready to reboot it and really look at what is it that the community wants to go forward. Because like Bob said, with the changes in funding, it's going to have to be coalition driven. So we got to look at where people want to go with this. I want to go back to Ethel's comment about the mandated programs with no funding. Last year, hopefully it's coming through okay. Last year, the HOPE legislation, which stood for heroin, heroin and opiate prevention and education. It was Representative Nygren out of Marinette. He put together a bunch of bills that went through, and I think that they're all actually on our website from a previous meeting. If you want them, I can send them to you. But there's there's things in there that's exactly what you said. There's things in there that says, increase this and have this program, but they're unfunded mandates. So there's no funding to actually get it off the ground. So, with this, what this is going to be helpful is with our enforcement arm. Danielle mentioned the pillars. In that Scioto report, we broke it into 5 different pillars. It was broken into prevention, which the HOPE legislation, while it has prevention in the bill title, there's not really any prevention in it. It could have done more there. Prevention, there's treatment, there's harm reduction, which includes the needle exchange, the use of Narcan, there's enforcement, so that would be from the boots on the ground law enforcement through the prosecution, and there are different laws. And then we put a business pillar in there as well, because when you talk to any policymaker, they talk about jobs and the economy, and when you look at substance abuse as general, there's nothing that's impacting our community on a level like substance abuse is. It's definitely something that's impacting our community members' ability to have their basic needs met. So I think that as we go forward, there's so much more that we can do. There's a great turnout here again. Share this video with your people. Check out the summit video. It was fantastic. Dawn made people cry. It was very emotional. I stepped out. Nobody saw. But if there's any other questions for Agent Kumm, I'm sure you can hang around for a little bit yet if you want to talk to him individually. Talk to each other. Is there any other? I saw your hand go up, Ethel. So, question?
I was just going to also comment that the direct focus was about heroin, but as substance abuse in that broader umbrella, meth is one of them, and then you know that oftentimes we have the fires with the meth. So again, that connection, Red Cross needs to be there. I mean, there's a lot of connecting here that I don't think we really, realize how important those connections are.
Absolutely. And there's a lot of studies that show when you focus on heroin or another drug will pop up. And in our community, meth is that drug. Absolutely. Did you have a comment?
I do. So I just was thinking about this report that you sent over, and I think that there are some great recommendations, but I really hope that when this is being shared with our leaders, that Scioto report is being shared with it, because I feel like to combat this problem, there's a spectrum of services that really need to be provided, and we, and I think you get that, and I think everybody else in the room, but I just really want to touch on that, because in here, like, you see the needle exchange portion is kind of a little bit negative, and I think that there needs a harm reduction piece that needs to come out, because in doing those services, I often became a social support for people that didn't have them, and they would ask about treatment, and they would get curious about it, and nobody wants to use heroin forever. Like, it's not something that people choose to do. So they choose to try it, but they don't want to stay a heroin user. So I think that it's important that this goes in conjunction with the Scioto report and what's in there, and I hope that they're shared together. So that's all I wanted to comment.
And it's kind of a final thought. I think there needs to be a sensitivity around substance abuse in general. This is my little soapbox commentary, because these are our brothers, these are our sisters, these are our families, these are our neighbors, these are the people we sit next to in church. You can't look at somebody, you can't look at a kid and be like, that kid's at risk. I think that we need to keep that in mind, because I've heard some derogatory terms like junkie, using addict in a negative connotation or a negative term. I think it's just something that I encourage everybody, you know, it's our job to take care of our community and support recovery. So, you know, while relapse isn't inevitable, it is highly possible. We just need to continue to support those folks. So, thank you, everybody. Babo, any final words?
Yeah, if you would, make sure you fill out the evaluations. It's really important on, you know, what you think, what was successful, any changes you can get. If you have any ideas for short-term action teams, please send them out. You know, we can always talk about them. We talk at our board and in our executive committee and stuff, but we definitely want, you know, everybody's opinion on it. If there's some issue that you think you'd like to tackle, you know, we'd like to hear from you about it.
And make sure you sign in, please. Thank you. Well, feel free to hang around and mingle if you'd like. Good to see you all. Have a wonderful rest of your days.